What's up, rookies? I've been working on something that I wanted to share with you to see if maybe it's something that you would be interested in, especially pharmacy students who want to practice working up patients either before an exam or before you go on rotations. When I was in pharmacy school, we would have a patient simulation. The professors would give us a patient case. We would have the labs and the imaging and all the objective data that we needed, as well as the subjective. And we would kind of practice digging out information from all of those things to put together a patient case scenario and work up the patient and soap the patient and practice presenting it to a professor who the preceptor. So that kind of gave me an idea. And I did a similar thing for DKA, 4 years gangrene, several ICU type scenarios. And I wanted to show you so you can tell me what you think. And if you think it's something that you're interested in, DM me and I will send it over to you. All right, so let me share my screen. Okay, I think this is the best view I can give you. I was hoping to give you one of those full PowerPoint presentation views, but I cannot figure out how to do that right now. If you do, let me know. Okay, so look at this. I'm calling it the Rookie Pharmacist Teaching EMR. And this is a DKA case for an acute care rotation, perhaps. And you know that all my cases that I present here on this platform are inspired by real life cases, real questions that I get from providers, real patients that I get to work up and work with. So none of that is made up. And I think that's what makes it feel more realistic. Our cases in pharmacy school were very clean, it was very straightforward, but real life cases are complex. They're not like what you see in textbooks or in class. So that's what I like about this is that they are inspired by my real work experiences where I've just kind of kept the data together. So this is a de-identified DKA case. So you have this first page here, the first tab is a patient summary. You have their age and gender, the medical record number, of course, it's de-identified, the admission date, admitting service, internal medicine, ICU, the attending, I de-identified that as well. The clinical pharmacist was me, the rookie pharmacist. And you get here the kind of reason the patient is here. Patient presents with 3 days of progressive worsening abdominal pain and nausea, vomiting, and whole body aches. And you have the past medical history right here. It's a type 1 diabetes patient, other past medical history, opioid use disorder, their home medication list, Lantus, Lispro, mirtazapine, allergy. Then you have the vitals tab, the way you would see them in comprehensive flow sheet and Epic or the vitals graph and trends and all that. So this is gonna, instead of me giving you the case and the subnote, I'm giving you the data scattered. And then just like you would go into Epic and click into results review, click into micro, click into labs, click into order management, click into diet and all that, you can do that here in this Excel sheet and use it to practice, right? So you got your vitals, you got your lab results. How cool is that? Lab results, admission snapshot, the BMP, basic metabolic panel. And I think this is really helpful for students because if you haven't yet memorized what's in the BMP, what the normal values are, I got that here for you. Sodium was 138, and here's the reference range. Is it normal? Yes, because it's green. So yeah, you got all the labs, you got the electrolytes, the CBC, and other stuff. What do I have on the other here? The lactate, the A1C, and then I also give you lab trends from day to day. From see here the glucose from admission on April 17th to April 20th in the morning. You see that they came in with a glucose of 787, and then a few days later, 138. Maybe I'll even use this these strands and make a graph just like you would see in Epic, right? Anion gap, creatinine clearance, creatinine, white blood cell count, potassium, the glucose flow sheet. And because this is a DKA case, I didn't give you the entire patient's EMR, right? So I kind of picked what was relevant to DKA. Still know how it would actually be in the hospital. You would have to know which tabs to go to. But the more you practice with this, the more comfortable you will be when you actually have Epic in front of you on your rotation, on your new job as a new practitioner. Maybe if you're transitioning from retail to inpatient or from managed care to inpatient, this can give you a feel of what's happening, right? And then antimicrobials, the antibiotics, the dose, the days of therapy, blood cultures, are they pending? Is there any growth, etc., etc.? And then you can see here the stewardship action. The ID pharmacist went and probably did rounds with the ASP doctors, and those were the plans that they came up with. And you have the inpatient medication list, the insulin drip, the IV fluid, the Lantis, and I categorize it by classes for you. And again, it's a great learning process. What else do I have here? Micro and imaging. I think this is as close as you're gonna get to an EMR. I'm just saying, without actually having access to it. So you have all this information. Now you use all of this, you put all of this together and write your SOAP note. I'm going to add some other components to it. I should definitely add an answer key for sure so that you know if you did things correctly. And then maybe another aspect I can throw at you here is now presentation. And then maybe when you're done, you call me, you book an appointment with me, and then you present, and then I give you feedback and all that. Tell me what you think. It's a teaching reference for pharmacy students, especially preparing to go on rotation. But as you can see, you can use it if you're a pharmacist from any other kind of setting, transitioning to inpatient pharmacy, transitioning to internal medicine or to ICU medicine. This should be helpful, right? So comment down below, and if you're interested, send me a private DM. I have all kinds of cases. Maybe I should pull up a couple of more and show you. Hold on. Okay, I'm going to share one more case with you. Here we go. So this is a case of disseminated Mycobacterium canceri in an HIV/AIDS patient on the medicine floor. Again, this is the cover page, summarizes the case overall. And then you have the patient summary, which tells you the patient's age, kind of like the patient's demographic page. Then you have their vitals, their lab results, their lab trends, HIV viral load results, trends from a year ago up to like most recently. I also have an ID workup, tuberculosis workup, sputum cultures, CMV PCR, HSV PCR, fungal workup, all the workup that was done in this patient. TB quantiferon, toxoplasma. I have an antimicrobial flow sheet for you. It's the hospital medication list. And then here I actually give you a key, a drug interaction tab, because that was what prompted me to be involved in this case. The doctor had questions about drug interactions, and then I give you the key. So you can do all this work on your own, pull up all the information on your own. Look, I even have social determinants of health. How cool is that? The orders, is the patient on regular diet, NPO, liquid pureed diet, monitoring orders, and in other cases, like ICU cases, it would have like your RAS score, your RAS goals. I'm so excited about this project, guys. Doctor's notes. I replicated the attending physician notes, PT notes, respiratory notes. If you want to see more, DM me and I'll send it over to you. Okay, I just wanted to take a few minutes and share this with you because as I was working on it, I was like, this is good. I'm excited about this. I'm curious if other people think it's good. I think it's good. Maybe I'm biased because I'm working on it, but please let me know. Yeah, that's all I had for you today. That's all I wanted to share. And I look forward to hearing from you in the comments. Please, if you're on YouTube watching this, subscribe because I got more content like this coming up to prepare students for rotations and to prepare new practitioners for inpatient practice. If you're on TikTok, Instagram, please follow me. I really appreciate the follow so we can grow this brand and this work together. My goal here is to help pharmacy students transition from the classrooms to practice with that clinical reasoning gap in between that they don't really teach us in pharmacy school, not because they want to, but it's a difficult thing to teach. And it takes a lot of hands-on and experience and practice to do that. Bye, rookies.